para ipakita ang tunay na estado ng ating bansa. Ilahad ang mga pinakabagong balita at pangyayari sa ating bayan. Ipaalam sa taong bayan ang katotohanan at ipaliwanag ang mga hakbang na ginagawa ng pamahalaan upang manatiling payapa at maiangat ang pamumuhay ng bawat Pilipino. Mula sa Pangulo ng Republika ng Pilipinas, Mayor Rodrigo Roa Duterte, ito ang Talk to the People.
Good evening, my countrymen. Alam mo, nagpatong yung problema natin ngayon. We will just have to deal with this rising cases of infections. Originally, it was COVID-19. Then it went to connect with the Delta. And then, ito ngayong bago, Omicron. Tapos may reported cases of a new variant emerging in the countries of Europe, yung IHU, pati I think I don't know, I'm not sure, but I just heard it from the international networks. May bago corona. So, nagwala the microbes in the planet Earth is spreading like a wildfire, and we can only offer to our countrymen the best of the medical care that's around not enable us to deal with the challenges every now and then. Pati yung screen mo, may COVID siguro, humihingal. I see now, I don't see them, I see now. Can you fix it so that I'd be dealing with some of the guys in the panel. I would be requesting them to help give us the input. Pero sa bagay nandito sa akin, dito sa screen na malapit sa akin. So, I will just read the rundown of the day's events. Then, I would ask the task force yung sa kung ano ang it's the basic things. It's always medical care. Medical yan. So, ang importante, medicines. Aside from that, yung prevention of people na unvaccinated would go around. Baka alam na nila, hindi nila alam mayroon na sila, and they would go around, and because they are not vaccinated, if they are also contaminated, they would spread the disease among his fellow men. Kaya some lawyers saying that we cannot restrain. Ako, measures, I said the ministrant functions, I repeat, of government is to come up with measures to protect the public interest, public health, public order, public safety, and blah, blah, blah. So, in the absence of a law, yung presidente is called upon to act And because it is a national emergency, it is my position that we can restrain, and that I have ordered the barangay captains, because under the law, ang barangay captain can enforce all the laws of the land within his community. That's the long and short of being a person in authority. Lahat na batas, except those reserved for some sectors, agencies, and the president, lahat, they are mandated to enforce the laws of the land, all laws within their jurisdiction, except the exemptions that's reserved for some officials or agencies. That is my position, and I'm now giving orders to the barangay captain to look for those persons who are not vaccinated, and just would request them or order them, if you may, to stay put. And if he refuses, he goes out of the house and goes around in the community, or maybe wherever magpunta, he can be restrained. And if he refuses, then the barangay captain, being a person of authority, is empowered now to arrest the recalcitrant persons. That is in addition to the police power, the agents of a person in authority. Yun ang ano. And a person in authority, the barangay captain, can also mobilize civilians and adopt them as give them the task officially, probably written, and that converts their status from being a civilian but also a person in authority called upon to assist the persons in authority. They now become agents of a person in authority. That is my position. Bahala ng, they can file cases. I'd be happy to answer. Sabi ko na, mayroon naman akong kaso sa ICC, di ipatong na ninyo para isang sagutan na lang pagdating ng panahon. But I hate to say this word, pero these words, being the president, ultimately, I am responsible for the safety and well-being of every Filipino. And that is why my orders are to restrain them. Hindi naman kaagad arestuhin. Pakiusap lang. Hindi ka nagpabakuna, then you put everybody in jeopardy. You go out, you get contaminated, dalhin mo. Ngayon, por pamilya, por bahay ang contamination. Let me just read the report of this is a collected or called from the report, different reports from government. I speak to you tonight with much concern over the rising cases of new COVID-19 in the Philippines, particularly in the National Capital Region. From around 5,400 new cases on January 4, please, I repeat, from around 5,400 new cases on January 4, it went to more than 17,200 by the January 6. More than tripled in just a period of 2 days. That is how the problem is galloping in our community, in our country, and in the world. So, meanwhile, another variant has also been reported in the so-called IHU variant, which was first detected in France last November. May dadating rin ito, whether we like it or not, dadating to. And because we cannot you know, when a Filipino comes home, you cannot bar him from going back to his country. That's ridiculous. So we might come up with a more stricter. Total, nandiyan naman yung mga police. Nagbigay naman si Secretary Anyo. That should give us the guarantee that there would be no more violations of that nature. Pero yung papauwi, total, mayroon mang mayroon man ng yung swabing pati the mandatory, I think, of being in the quarantine houses, the hotels. I commiserate with the problem of the hotel. I know that they really want to enforce the law also. But I said, when it comes to squabble, their powers are very limited kasi civilian. The police would be in a more a potent deterrent from persons who do not want to honor the law. Meanwhile, another variant has also been reported in the so-called corona. Mahirap to. To provide us with more insight of these developments, may we now ask our expert resource persons to further enlighten us about the threat of Omicron as well as this other new IHU variant. Almost all of us here dito sa aming in this camp, walang marunong dito. We can only listen to you. We cannot even offer even the smallest thing about how to control or how to treat these coming variants in addition to what we are suffering now. I would like to call again, alam mo sir, we would like to spare you from spending so much time, but ikaw yung one of the persons or medical persons relied upon the government to give us what should we do, how should we treat this. There are already implemented programs, but if there is something that we can offer in addition, we would be happy to hear from Dr. Edsel Salvania, member of the Technical Advisory Group for COVID-19 and infectious disease expert. Dr. Salvania, you have the floor.
Good afternoon, Mr. President. Good afternoon to the cabinet members and to my fellow resource persons. May I have my slides up, please? Presenter. All right, Mr. President. So I'm just going to give a quick briefing about IHU and latest also on Omicron. Next slide, please. Next slide.
What's happened with the technical guys? Ayan.
So yung IHU po kasi, this is not an official variant of concern or even an official variant of interest. Ang World Health Organization po ang nagsasabi, ang nagde-designate ng variants of concern and variants of interest. IHU is the name of an institute in France po that described this particular lineage of the virus. And the WHO has already been monitoring this since November of last year. Ito po yung lineage na B.1.640. At so far, wala naman, marami po siyang mutations, pero wala naman siyang pinapakitang parang survival advantage or immune evasion na nakikita natin sa Delta or sa Omicron. It's a variant that is being monitored, but it is not yet as concerning as Omicron or Delta or even the other ones po, like yung Alpha, Beta at Gamma. So ito po ang release ng WHO, ang sinabi po nila, it is not a threat at this time. So it is something that we are monitoring. And even the people who wrote the paper from IHU, ang sabi nila, it is too early to speculate on the virological, epidemiologic, or clinical features of this IHU variant. So the bottom line po, Mr. President, is we will continue to monitor this po. But right now, I think our attention really has to be on Delta and Omicron because this is really wreaking havoc all over the world. Next slide, please. I think that's the back one. So in summary po for IHU, IHU is not a variant of concern. It is not exhibiting increased infectivity or immune evasion at this time. So gumagana po yung bakuna natin for this. WHO is monitoring it, pero hindi pa po siya VOI or VOC. It's designated as a VUM po. Actually, nanay niya yung designated na VUM, yung B.1.640. The thing to remember po is that yung mutations po natin, kahit madami pa yung mutations, they do not necessarily translate into immune evasion or more transmissibility. Kung naalala niyo po, Mr. President, yung P3 natin or Theta na describe una dito sa Pilipinas, dati po naging VOI yon, it was called Theta, tapos naging VUM, variant under monitoring, tapos natanggal na lang siya. Nakakatakot siya kung titingnan natin yung mutations niya, but it did not pan out. Actually, tinanggal na siya sa monitoring. So hopefully, ganito rin po yung mangyayari sa IHU. But of course, we have to continue to be vigilant kasi marami po talaga itong na-generate na variants, especially among people who are not vaccinated. Yung mga hindi po bakunado, mas madaling mag-mutate po yung virus sa kanila. So in a way, if we vaccinate a lot of people, we are also preventing the emergence of these variants. So ang conclusion po ng WHO is that IHU is not a threat at this time. Next slide po. So just to update you, Mr. President, on Omicron, and we are getting more and more data about this, it really is more transmissible than Delta, particularly because yung vaccines na hahawa pa rin kahit fully vaccinated. Although our vaccines continue to work naman to decrease the risk of severe disease. It is less deadly compared to Delta. Nakita na po yan in comparing 500,000 people with Omicron and 500,000 people with Delta in the UK. You are 3 times less likely to get hospitalized with Omicron compared to Delta. And of course, that goes down even more kung bakunado po kayo. And the vaccines significantly still protect against severe disease. Giving boosters will add more protection. And vaccines also decrease infectiousness and risk of mutation. So if you're vaccinated, may chance na mahawa ka, pero most likely, magiging mild po yon. And even yung paghawa mo sa ibang tao, yung risk goes down kasi mas mababa po yung amount of virus that you release into the air. Next slide, please. So ito po yung naging curve po sa South Africa, yung sa Gauteng province nila. Nakita po natin, mataas yung number of cases, yan po yung sa December, mataas, pero yung admissions are not so high. And very, very reassuringly, the deaths are not following the rise in cases. Of course, pwede pang magdagdag yan, pero we don't expect it to be as bad as Delta. Kasi kung titingnan nyo po, yung graph before that, yung pagtaas po, kasama po yung hospitalizations at yung deaths, halos sumasabay sila. But for Omicron, kasama na rin the fact that there are some vaccinated people in Gauteng, hindi po talaga sumasabay yung death. So even if we're seeing many cases, basta mataas ang vaccination rate natin, we hope that the number of people who will end up in the hospital will remain relatively smaller and the number of people who will die will remain low. The problem is, yun nga, pati yung healthcare workers natin nagkakasakit eh. So, kailangan po talaga natin rin silang protektahan. Next slide, please. So, ito rin po yung pinakita sa ages, yung Omicron wave across the board po, whatever age, mas mababa po talaga yung risk that someone will end up in intensive care compared to Delta. So, it is not zero. So, meron pa rin talagang magkakasakit, magkakaroon ng severe, but it is about half that of Delta. So in a way that helps us because then yung healthcare capacity natin will hopefully, as long as maraming bakunado and we can keep infection rates under control, we may be able to cope. May laban po tayo as long as mataas ang vaccination rates. Next slide, please. So even in South Africa, sobrang taas po nung cases nila. But then it started to go down in a matter of about 4 weeks. So magpipik po talaga ito na mabilis. We expect na mabilis po talaga yung pag-akyat nung cases na nakikita po natin. But hopefully, we follow the trend that happened in South Africa, very quickly bumaba rin. Dahil kung maraming bakunado, mauubusan rin ng hosts eventually itong Omicron. Ang problema po natin yung mga provinces na mababa pa ang vaccination rates, pag makaabot ang Omicron doon, baka sila ang magkaroon ng severe disease if mababa pa yung bakunado, especially among the vulnerable population. But here in Metro Manila, Mr. President, we are hopeful as long as we can keep our healthcare system open, that even if we see 20, 30, 40,000 cases in the next few days, as long as many of those are vaccinated, the stress on our healthcare system will be manageable po. Next slide, please. So how do we prevent Omicron? Our face masks, our face shields, physical distance, these still all work. Ang problema po kasi talaga, it's not 15 minutes na lang eh. Fleeting contact lang pwede kang mahawa from Omicron. It's very contagious and it spreads very fast. If it takes 5 days to get symptoms from Delta, it only takes 3 days to get symptoms from Omicron. So mabilis yung paghawa niya kasi when people have symptoms, mas nakakahawa sila. The treatment is the same for the most part. We are able to treat the most severe patients with the medications that we have. But it is also very important po na we have to keep our hospitals open. We have to prioritize the sickest of the sick. Kasi hanggang ngayon meron rin pong mild tsaka moderate na napupunta pa rin sa ospital, and that is crowding out people who really need to be in the hospital. So we hope that as long as maraming nabakunahan, we can actually take care of these people at home safely because the risk of bad disease kung Omicron yan and fully vaccinated sila is very low. Parang sa flu lang po. So again, basta bakunado, kahit mahawa ng Omicron, chances are it's going to be mild. It's going to be like the cold or the flu. And as long as they are able to isolate as soon as possible para hindi sila makahawa sa ibang tao, we will hopefully be able to ride out the Omicron wave po. Next slide. So in summary po, ang Omicron po mukhang milder po talaga siya than Delta, which is good news. But the bad news is it is very transmissible. And then the good news is that the vaccines will prevent severe disease. They continue to work. And if you get Omicron and you are vaccinated, most likely mild lang po talaga. Even my own patients nakikita ko, nung nasa Delta po, pag meron po silang Delta, yung lungs po nila, sunog na sunog po talaga. Pero ngayon, itong mga Omicron patients ko, lalo na yung fully vaccinated, napakalinis po ng lungs nila. And usually mild lang talaga yung disease. But of course, they still take up space in the hospital. So we really have to triage properly. Yung pagbo-boost po natin was a very good decision because the data is showing that boosting further protects against hospitalization and transmission. We have to protect our healthcare system. Marami pong healthcare workers po ngayon, Mr. President, ang nagkakasakit na even though mild naman yung nakukuha nila, it's still a strain on our healthcare system kasi wala ng nurses, wala ng doctors. Pati ako po ngayon, quarantined ako kasi may exposure po ako. Although wala naman po akong sintomas and my last test po was negative naman. But I need to quarantine because na-expose po ako. So we expect very high numbers of infection. But if many of us are vaccinated, we will be okay po, Mr. President. Thank you very much.
Salamat, Dr. Salvania. You know, just an observation. I was appalled to see on TV the other day that there are still thousands in Metro Manila lining up for their jobs. So kung ganito sila maybe they are willing but nagpo-procrastinate. That's a problem, procrastination. Marami pa talaga ang wala eh. So that would keep the barangay captains busy to personal. Kung wala na sila na ang mag-survey, just simply asking people if we are vaccinated. And if he gets the real truth about sa tao, then just request him to hair or para walang gulo, iwas tayo. We do not want trouble. We do not want to be imposed on you. Just stay so that we will all be safe. Yan lang naman eh. Talagang naataka ako na napakarami pala to ang wala pa. So, hindi na lang hintayin kasi pag nagpatong-patong, pag nagtapatong COVID, at saka sumakay itong si Omicron pati si Delta, goodbye Philippines. This will be your, well, you can hardly survive kung it will attack yung lungs mo. I have heard a friend early on na ano siya, nasabi ko na to sa inyo, but I will repeat it for those kasama ko sa motor. Tumawag siya, sabi niya, tulungan mo ako kasi hindi na ako, I can hardly breathe. Ang asawa niya sa ospital rin. So, sabi ko, nandiyan ka naman sa ospital. Maybe I can just also call their attention. Sabihin ko na pakidalian lang ang gamot kung meron para sa kanya at asawa niya. You know, it's very tragic. They have only one child, a daughter, pero malaki naman. The following day after he called me, ang asawa namatay. The day after, Bisaya ako, ang asawa kasi babae sa Bisaya. Bana is the husband. Namatay rin. So, kaawa ang tao talaga. So, hindi na ako nagtanong kung nakapagbakuna ka. Maaga pa yun, first week of the onset of the contamination of the city. Siya pa ang tinamaan. Kayong mga hindi pa, makiusap na lang ako sa iyo. Huwag na lang ito daanin sa galit-galit. May I just really earnestly request you to get your vaccine. Do not procrastinate. Sabihin mo bukas na. Because the bukas might be the day that will you start to die pag nagpatong na ito. Kasi wag kayong kindly tune in. Kung ayaw kayong marinig sa akin, okay lang. But listen to the experts. Because it will save us all. Alam mo, sabi nga ni Dr. Salvania, mapunta ka ng hospital. Ang hospital ngayon puno. So we are activating the places which we originally intended to be a hospital or extensions of hospital, yung Rizal Memorial Stadium, I think. And the others, gagawin na natin, prepare those places because this is really getting worse every day. It's very fast. Ang problema niyan, kung madapuan ka sa lahat at nagpatong yan and you get the original COVID-19, I do not think, kaya nga yung mask but you have to pardon me, I don't feel, tignan mo, ang boses ko, wala na. Huwag dumadating ang mask. Pero pag tanggalin ko ang mask, maganda na ang boses. Marignan na ninyo ako. So, well, that's just an observation. May I call on again, maistorbo ko kayo, Mr. John Wong, you may add something to what we are facing now. Dr. Wong, John.
Good afternoon, Mr. President.
Yes, good afternoon.
I agree totally with Dr. Salvana. No? In the face of this Omicron, even though it's mild, no? And so far very few people have died, no? We need to reduce transmission, and we can do this by reducing mobility, reducing contact, no? Encourage people to wear masks, no? But also to get people to test right away, no? When they're symptomatic, no? A lot of the infections are spreading, or a lot of the transmission is spreading because people are symptomatic, but they will do this before they get tested, no? All the while caring about their businesses, no? But most important of all, I think we need to vaccinate the rest of the population because a lot of the people in the hospitals now, no, both locally and also globally, no, where in many of the countries with Omicron, a lot of the people in these hospitals are people without vaccination, no, not people who have been vaccinated but do not have boosters, no. So it's the unvaccinated, no, rather than the unboosted that we have to prioritize, no, especially the elderly. Thank you, Mr. President.
Okay. Are you through, Dr. Wong?
Yes, sir. Yes,
Tapos
Mr.
ka na.
President.
Well, it was a good reminder for everybody. Ako kasi, I know that there is a problem. I know that it is progressing, it's getting worse every day. Now, ako kasi, by nature, pag may problema ako, kima-personal ko sa buhay nito, I imagine the worst, how far it can go to make me unhappy and sad or afraid. Tapos, inaano ko talaga, what's the worst that can happen? Yun ang iniisip ko din. Slowly, I try to rationalize everything. Maybe I can do this, I can do that. Hanggang meron akong structural way of solving the problem. Dito kasi, because of the how fast it's going, we have to look at the problem on the worst case scenario. Total, kung preparation natin, tapos it will simmer down into something na hindi masyado, walang mawala sa atin eh. Ang problema, kung talagang bahay por bahay na ngayon eh. So, it affects all the members of the house or home. Ang problema, how do we meet this huge challenge? Kaya we have to activate yung mga facilities that were converted into parang extensions of the hospital. Now, isip ko kasi kulang talaga, as you have said, kulang tayo ng medical guys. This is just a suggestion. If it is not good, then just let it pass into from ear to ear. Kung yung mga, anong tawag ninyo, ma'am, yung doktor, yung mag-graduate na, yung naghihintay na ng results ng o basta yung tapos na. Maybe they can help this country, their country, his country, her country, by volunteering to assist us kung gusto lang nila. Total, they have the knowledge of how to protect themselves. At least the barest minimum that they can do to protect them, maybe they can help us by volunteering, or baka may naman to, baka they would want to, sabihin na natin pagod kasi pamasahe, if they have their own transportation vehicle, private, gagastos rin sila ng gasolina. We will just, hindi naman token, but yung sweldo ng gobyerno, it's good for 8 hours. Magkano nga ang sweldo ng isang nurse? Magkano ba ang going rate ng nurses? Wala ako, but Secretary Duque can find out. Well,
yes, Mr. President.
How much did you pay for those guys who volunteered dito?
Sir, binibigyan lang natin sila ng stipend. What you're referring to are the postgraduate interns waiting for the results of their board exams. So they are being asked by the hospitals where they finished their internship to help, to volunteer. So meron na po tayong programang ganon na nakakatulong po sila on top of our regular human resource for health. And we also have an augmentation program, Mr. President. So if hospitals are overwhelmed in Metro Manila, as an example, because of the very high cases, we deploy and augment our healthcare workers from the Visayas and Mindanao and from the neighboring Luzon DOH hospitals to help, especially when they're coming from areas with low cases, low number of cases. So we are also putting together, and which we have done before as per your instruction, yung augmentation from the Philippine National Police as well as the Armed Forces of the Philippines. So we are making sure that all available healthcare professionals will be on deck and prepare for the worst case scenario. Tama po kayo, sir. We really have to prepare for the worst case scenario. And that is exactly what we have started to do, Mr. President.
Ay, sir, kasi inimbita ko ang armed forces. I wanted to talk to them, pati ang police. Be a business for the military and the police to maintain order and help the civilians. Whatever. Sarado ang mga hospital. They are refusing new admissions kasi it can become there might be some, alam mo na, we want to help, and if you just can wait, we will mobilize all persons. Pero kung maggrabe ito na lahat tinamaan, bahay por bahay, hindi sabihin nag-martial law. No, not that. The military has to sacrifice. Kunin nila yung kung saan nila dalhin o police. You know, that's hindi lang kasi nakaintindi ang publiko ng role ng military pati police. Lahat ng natin, bagyo, landslide, sunog o riots, it's always the police and the military. Lahat yan nila. If there is to be dug sa landslide, police yan. Ang police kasi, pag sinabi maghukay ka dyan ng patay, they not say no. That's the reason why hindi ko naman love the military and the police. I'm just kind of I treat myself as one of them para maintindihan. I think like in military, because I have dealt with them over a period of time, and the police because they were under me when I was mayor. Nakukuha ko yung nila. So ito yung mga tao na sabihin mo na gawain mo yan. Yan ang... So they should prepare for that eventuality. You know, pagdala ng at least the barest minimum na if you want the maximum protection, you can use a double mask or something. Maybe spray yourself with meron dyan mga bago. Sprayhan mo lang yung sarili mo para kung madapo. Mahirap kasi nandito kasi mayroon dito kanina na madapuan ka lang. I cannot understand na dapo na physical contact o handshake o baka lahat na yan. So contactless. Less ang contact, the better. We are not in the same league with other countries. America is suffering nearing 1 million mark sa nila nagkasakit. And we do not know if it is a new variant or it's still the same COVID-19 that's overtaking the health of everybody there. Tayo, we are 10,000. It's time to activate what we have prepared for a long time. We prepared for something like hospitals, auxiliary people, and this time I would call on my countrymen, the young doctors and nurses waiting for the results of the exams, and if you want to help, I can give you the allowance that was given in magkanong Secretary Duque, magkanong bigay mo sa mga nung tumulong?
Yung po mga tumulong, Mr. President, kung yung meron po tayong tinatawag na special risk allowance na nagbibigay po tayo, I think mga 5,000, but that will depend on may criteria po if they are actually directly catering to patients or in contact with COVID-19 patients. Yun po yung binibigyan natin ng special risk allowance. That includes doctors and healthcare workers from the private hospitals. Samantalang sa government hospitals naman, on top of the special risk allowance, we are also giving them the actual hazard duty pay. And also, these are on top of their compensation or salaries, Mr. President. So dagdag po ito based on your directive since 2 years ago when the pandemic struck or began. So ito pong mga postgraduate interns, we can actually come up with a compensation kasi habang wala pa yung kanilang board exam results, pwede naman po sila magtrabaho, mag-volunteer. But we can incentivize by giving them a certain amount. We will have to determine that. Although ang mga doctors kasi, Mr. President, na first-year resident will receive about 59,000 pesos a month. Yan po ang kanyang sweldo plus other benefits. So we can start using that as a benchmark, Mr. President.
I think that the 5,000 is masyadong maliit ngayon. Considering the attendant danger to the guys, medyo they should be given more. Take into account the possibility of danger na they themselves will get because of they have to go near and they have to treat those people. I will increase, hindi ko pa masabi magkano, wala mang budget dito. Wala. Ikaw bong.
Mr. President, yung 5,000 that's on top of a much higher compensation. Parang ko lang ho yun, dagdag lang ho yun doon sa binibigay natin ng mga salaries sa ating po mga healthcare workers. So tama po kayo, 5,000 is a pittance that will not really attract or properly incentivize these volunteers, no? Considering the risk that they will face. So a much higher amount is in order, Mr. President. Salamat po.
I agree with you. And I have, well, to those who are entertaining the idea of getting into the role of volunteers, I will raise the amount. Basta total, ano man naman yung pera, ubusin na natin yung pera nitong gobyerno to para sa inyo. Kung wala na, maghintay na lang tayo ng lahat. Just, but I do not think that we'll run out of money. Secretary Dominguez is a very resourceful person. Wala naman tayong, nandiyan naman ang World Bank, hiram tayo kung wala na pera. Pasalamat rin tayo doong tumulong dito, but I would do it during my extra time later. I would like to thank the people and the countries that extended their helping hand. So let us complete our story here about the COVID. I now call on Dr. Marisa Alejandria. He is the member of the technical group of COVID-19 and infectious disease expert.
Good afternoon, Mr. President. Thank you for this opportunity to share information also on Omicron and to remind our public on how to prevent transmission of this new variant. The concerning feature of this variant compared to Delta, again, we'd like to emphasize the high transmissibility of this variant. So, mas mabilis po siyang makahawa, kaya ang advice po natin sa public is to isolate right away, even if with just very mild symptoms. Kahit wala pang result, kahit walang test, at wala pang resulta yung test, dapat mag-isolate na po kasi mabilis po siyang makahawa. Buong household, madaling mahawa. Kaya ang isa naming recommendation nga po is mag-isolate na yung buong household once merong isang may symptom. So, may mga guidelines po on how to manage mild cases at home na ipapamahagi namin sa publiko para hindi na po sila kailangan pumunta sa ospital kung mild lang yung cases, mild lang yung symptoms na nararamdaman, bakunado, so pwede po silang alagaan sa bahay para hindi po mapuno ang ospital, preserve natin yung hospitals for the severe and critical cases and for other cases na non-COVID na nangangailangan ng hospitalization. So, yun po ang pakiusap natin sa publiko. And then, wear mask properly pag lumalabas ng bahay. Then, of course, hand hygiene pa rin. Lagi tayong maghuhugas ng kamay. And then, we avoid crowding, super spreader events. So, kung pwede pa rin talaga iwasan yung translasyon, Chinese New Year celebration, tsaka yung Santo Niño, no? I think that will help, no, in the next few weeks that we expect the cases to still continue to rise dahil mabilis nga po itong variant na to. So, and then we can also have teleconsults, no? Dito pwede yung ating mga postgraduate interns, volunteer doctors, no, we can utilize them for teleconsults, telemedicine, to provide guidance to our community who are experiencing symptoms to assure them that they can be managed at home. Yun lang po, Mr. President. Thank
Salamat, Doktora. Then, Doktora Cynthia Saloma, the Executive Director of the Philippine Genome Center.
Good evening po, Mr. President, and thank you very much for the opportunity to speak to you and to the Cabinet today. Gusto ko lang pong sang-ayunan yung mga advice ng ating mga public health experts tungkol po sa mga things that we have to do and the things we have to prepare. So yung sasabihin ko po, Mr. President, dagdag na lang ito sa mga advice nila. I think, Mr. President, honestly speaking, it is very important that we prepare our public for the daily news na talagang tataas at tataas ang kaso, primarily because of the nature of the Omicron variant. So, Mr. President, if you look at the data from the other countries and our experience with the Delta, Alpha, and Beta before, normally po, President, yung ating mga cases dito sa Pilipinas, yung peak natin nagdi-delay ng mga 1 month to 2 months. Pero itong Omicron, ang bilis ang pagtaas na. So we're looking at figures na 5,000, tapos 10,000, tapos 70,000 today, and tomorrow it will be much higher. So it's very, very important that we manage these numbers as perceived by our public kasi tataas talaga po ito, Mr. President, considering the fact na yung signature ng Omicron, hindi gentle wave, is always like a needle ang taas-taas niya, no? So that is one that we have to manage. And of course, we know that because of our vaccination and prior exposure, ang mga cases in general, milder and asymptomatic. But because of the sheer number of potential cases po, President, sa Omicron, meron talagang mag-overwhelm o dadami ang ma-ospital. Kaya ito importante nating pag-andaan. Tapos, Mr. President, isa pang importante din, and this is also the experience of other countries, is na-overwhelm po yung testing centers. No? So, ang haba-haba ng mga linya. So, you will notice, for example, Australia with 92% vaccination, 64,000 po yung positive nila kahapon or today. And of course, France with 300,000. And other countries, these are countries with much, much better resources than us. And yet even their testing centers are stretched. Kung minsan nagkukulang po yung kanilang kits. So siguro paghandaan din natin, together with the DOH and other government agencies, kung paano po natin i-maximize itong testing kasi we don't want na yung mga tao, haba-haba ng linya, nandoon sa labas ng testing centers nagpapatest. So there should be preparation on how best to maximize the testing. Possibly, we should only test healthcare workers, those with comorbidities, and those na 60 plus and above. Kasi I already anticipate, Mr. President, that this will happen. As the cases, if the peak of Delta is about 26,000 in September, we can anticipate based on experience from other countries, double, triple, 4 times this amount. And for that value to be there, the testing should be 5 times that number. So it's very, very difficult to reach those numbers. So there, it is very, very important that we prepare for that possibility at the level of the testing. Siguro, i-maximize natin yon. And at the same time, Mr. President, on the one hand, we would like to assure our public that with vaccination and the practicing of our public health measures, ang ating pong kaso mas kaunti yung mapupunta sa ating mga ospital. But because masyadong maraming kaso at may mga tao pa rin hindi na-vaccinate, then it's going to fill up some of our healthcare facilities. So these are the things that we have to plan out and prepare our public for. Eventually, Mr. President, bababa din itong kaso, but we do not know how the peak will happen and what is the time frame that this will do. Based on the experience of other countries, it's about 4 weeks, but we don't know the peak that we will reach. But in the meantime, lahat ng magagawa natin at mga preparations na magawa natin kailangan, we have to put in place. At marami na rin po tayo, Mr. President, natutunan tungkol sa Delta. Pero yung Omicron is a different animal altogether because ang bilis talaga po niya, President, tumaas eh. Can you imagine values, 5,000, 10,000, 17,000 tomorrow and the next day, ilang numero ito. So this is something that we have never seen before, but of course we are protected with our vaccination. But it is also very, very important that we prepare our public for the numbers that will come out as the daily reports are released by the Department of Health. Yun lang po, Mr. President.
Salamat po, ma'am. Let us proceed with the reports from the field. Of course, we have Secretary Anyo, who will report on us on the prevention, implementation of prevention and detection, isolate, treatment of reintegrate vaccination, PDIR plus B. You have to explain this to us. Hindi ko intindihan to. NCR updates and that belongs to chair of the MMDA, Attorney Abalos. Secretary Anyo, can you proceed?
Thank you, Mr. President. Magandang hapon po sa ating lahat. Please, next slide. Mr. President, ito po yung ating paghahanda na ginagawa dahil po sa ating Omicron. Ang ating pong LGU ay nagsasagawa ng more aggressive PDITR or prevent, detect, isolate, treat, and reintegrate plus vaccine strategy. So makita po natin dito sa ating datos po, meron po tayong enough contact tracers po nakadeploy. Ito po mga barangay health emergency response teams ang ating inaasahan ngayon dahil sa dami po ng hawaan ngayon ay umaasa po tayo sa granular lockdown at house lockdown. Katulad nga po ng sinabi na kung meron pong isang nahawahan, more or less ay buong pamilya na po. Kaya mag-house lockdown tayo. At meron naman po tayong enough medical personnel din po. Sa atin naman pong isolation and treatment, ang ating pong mga quarantine facilities ay nakaready na rin po ang isolation facilities. At hinikayat po natin na talagang yung mga severe po lamang ay i-reserve natin sa mga hospital. At kung maaari dahil naman po mild naman yung mga symptoms, ay pwede na pong home quarantine at home care na lang. At sa vaccination naman po ay meron po tayong pinaplano uli, katulad ng sinabi ni Secretary Charlie Galvez ng isang another national vaccination. Kasi ito po ay nakikita talaga natin panlaban sa ating bagong Omicron variant. Hiningi po namin yung cooperation at support ng ating mamamayan. Be responsible for your own family. Kung meron pang hindi bakunado sa inyong pamilya, kayo na po sana ang mag-encourage at mag-influence para po dalhin sa ating mga vaccination sites, lalo na yung mga A2 at A3. Itawag po natin sa ating mga LGUs may programa po tayo para magbahay-bahay. Next slide. Additional din po, Mr. President, dahil po nga nagkakaroon ng parang artificial shortage sa mga gamot, hinihikayat po sana natin yung mga mamamayan natin na huwag mag-panic buying. We have enough medicine po para to treat yung symptoms, pero yung iba kasi ay nag-i-stock na sa bahay, kaya po nagkakaroon ng panic, at ang pagtingin po ay parang nagkakaroon ng shortage. So sana po ay makisama ang lahat sa ating, kayang-kaya naman natin pong labanin itong Omicron variant na to. Kanina po sa aming pagpupulong sa IATF ay magkakaroon po ng mga pagbabago sa mga palisiya, lalong-lalo na po sa isolation, sapagkat nakikita po natin na mapupuno yung ating mga isolation centers, kaya tuturuan po natin yung ating mga kababayan ang mga tamang hakbang kapag mag-home care para sa ating mga positive na nag-isolate. Sa ating po rin mga business and private companies, inikayat din po sana natin na unang-una ipatupad ang pag-comply sa mga health protocols at bigyan po sana rin ng suporta ang kanilang mga employees. Nakikita po natin na maraming tatamaan sa Omicron. Ang unang maapektuhan po ay ang workforce sa mga companies, business establishment, hospital, at even sa ating government services. So pagandaan po natin. At ating pong mga kapulisan ay ating dineploy para siguraduhin po na mananatili ang peace and order sa interzonal at intrazonal movement. Sisiguraduhin po rin na maayos, at ang ating pong mga local government units po ay nakahanda naman sa threat ng Omicron variant. Yan lamang po, Mr. President. Magandang gabi po.
Thank you, Secretary Anyo. Dito muna tayo kay Dr. Oscar Gutierrez, Jr., OIC, the Food and Drug sandali lang, may idagdag lang ako. Ang policy now is that there are departments na walang magtakbo, yung iba nag-resign. Kagaya dito. My policy is I do not take outsiders anymore. Kung sino yung second in command dyan sa opisina, departamento na yan, siya ang aakyat. No more outsiders para mas madali. Yung may alam na talaga, are those working permanently there. They are the ones. Total, pagdating ng bagong administrasyon, mapapalitan o they will go back to the same original position that they have occupied. So itong si Oscar is the second in command, the second person. Siya na ang magbigay ng report because he's the OIC. So, go ahead.
Magandang gabi, mahal na Pangulo, ngayong gabi. So I will make a presentation on the FDA updates. So a total of 89 approved test kits as of January 4 are listed as approved by the FDA. So these test kits remain to be reliable in detecting COVID-19 infections. So next slide, please. This, as of today, we announced that we are accepting applications for special certification for COVID-19, self-administered or the home test kit. Yung pinakita ko kanina na slide, these are the kit that will require health professionals in conducting the test. So I am calling for all the manufacturers and even the importers of self-administered COVID-19 test kits that to register their product in the form of a special certification. And we already met with the DOH, and they will be coming out with an algorithm, actually a guideline or policy on the use of these home test kits, considering that these products need to be administered by the patient or the household themselves. So kailangan po natin ng guidelines on the use, reporting system, even disposal of the waste, interpretation of the test results, and what action should the individual take when he finds out that he is positive. So kailangan po natin ng algorithm from the DOH. And this will be based on the claims made by the manufacturers. But in general, we need a guideline on this.
Let me interrupt you. Ito bang self-administered home test? Para dyan sa household,
Opo.
could be the father, the mother.
Yes po.
Yung ba rin yung turok?
This will be yung nasopharyngeal is up to the pharynxes. Ito nasal lang, dito lang.
Nasal lang?
And it can be oral. So depende po, we are waiting for the manufacturers and even innovators to register their products, and we will know po kung they will be applying for the nasal type or the oral type.
I hope they would have
Mas less invasive po
a
siya.
seminar in a GP personal hanggang ano lang.
Opo.
Kami, alam mo, galing ako ng Davao hanggang ang order ng doktor, kami dyan, araw-araw.
Oo.
Kaya, hindi naman masyado. It's not really that hard. You do not have to suffer. Pero araw-araw na, sa bunganga, okay. Ang problema yung ilong, kasi ikot-ikutin.
Bali dito lang po siya sa nasal lang, hindi aabot dun sa mga
alam ko.
Venezia.
Kasi dito, ano talaga, nurse ang, tsaka nakatingin yung doktor.
Ito self-administered.
Pero, kaya nga, pero araw-araw, this has been going on for, pati doon sa Davao. Sus Mario Josep, naghahintay na yung, akala mo na parang multo doon sa likod. Minsan, hapon kasi ako. Nandiyan na yung multo. Nandiyan na. Tangin. So, yun ang, just a comment. Kasi totoo naman, kasi sino? Araw-arawin ka ba naman? Kami dito, pati yung sila. Kayo ba, Colonel, ito si Kuya, babae man to, Colonel to. Araw-araw rin kayo kaawa. Marami pala tayo nagdudusa. Good. Nakikiramay kayo. Ikaw, araw-araw ka rin?
Ay, hindi po.
Hindi. Kaya baka, nagdaan ka ba kanina sa
Dumaan po ako.
Kasi kung hindi ka araw-araw,
Araw-araw po nag-iingat, nag-wear na mask, ganyan. Nagugas ng kamay, social distancing.
Ganito ang problema. I'm just wondering, dito umiikot sa utak ko, why the massive contamination? Nga halos every household. I can only give, I'm not guessing, but I'm just formulating a theory that it was because of the holidays. Yung holidays kasi nagbaba tayo ng alert 1, so everybody was out, including children.
Including the unvaccinated.
Ito yung rest back na yun. This is the result of kasi bigla kagaya ng sabi, January 6, Then, but it was only 5,400 cases. Then 2 days after, January 4 rather, January 4, 5,400. Then 2 days after, January 6, it's 17,200. Masyadong malakas ang, almost exponential ang akyat ng, so baka talaga ako, wala akong ibang maibigay na sensible theory. It was because of yung everybody was out and people were crowding everywhere sa Divisoria. So walang social distancing. Those were the essentials or the basic minimum of observance ng ng mga experts na ito yung mask. Nakalahat naman nakamask eh. Pero ang tingin ko bakit so baby contact para matanong ako, doktor, pati ba yung paglamano pwede kang mahawa or even just the body contact?
The proven naman po is by aerosol po droplets.
Yeah, so I'm just wondering why I said there are almost exponential rise in a matter of 2 days. Kaya yung pagtingin ko, it could only be a result of, there has to be a reason. Hindi pwede walang rason eh. Why the sudden rise? Sharp, right, in a matter of 2 days. There has to be a reason for that. Hindi natin bagay, bakit marami na ngayon? So, ako, as sabi ko nga, ultimately, I'm the one to be blamed. Siguro yung New Year's Eve, Pasko. Pero itong bago lang ito, it could only be a recent yung surge. And it could be attributed, tingin ko, by the people yung New Year's, a day before the New Year. And incubation period is something like 7. Incubation period of the virus.
I'm not so sure about the incubation period. Maybe Secretary Duque can.
Yes, but
help me out.
kasi I said we have to. Or if there is nobody interested in it, but ako as dito sa inuupuan ko, I have to know the reason why. Kasi hindi ako pwede bakit ganito? Magtanong ang tao, bakit so sudden, so many? Then you have to have an answer. Yun ang ko, because of the holidays. Walang ibang walang iba eh. Wala akong ibang mahanap na rason na bakit. Talagang ito na ngayon ang hinaharap natin. Of course, I'll ask Secretary Duque later bakit ganito. I am not really pressing you for an answer. I know that you are just too far away from the issue. Sige, you go ahead.
Yeah, sa next slide po, meron po tayong, meron pong EUA na na-approve, yung Ronapreve and Molnupiravir. Ito pong Ronapreve po, ito ay injectable po ito, I mean by infusion. Whereas itong Molnupiravir, it's the capsule form. So, dalawa po interesting dito, which we approved naman po October 1, 2021 yung Ronapreve, yung December 22 lang, very recently. Lloyd Laboratories is applying for CPR to manufacture it locally. So they completed the compliance requirements January 4, so it's under the evaluation by the FDA, Center for Drug Regulation Research, and we will farm it out course, to our FDA drug advisory expert.
Okay, let me ask you. Ito yung mga medicines, if at all, it should be given when you have already the COVID.
It's given to diagnosed patient with mild to moderate symptoms po.
Yeah.
Then we have a 5-day window period po to give it.
Kaya nga,
For 18 years old
maibigay
people.
ito yung may tama na, may
Yes,
symptoms na.
positively
It should not be
diagnosed.
given to a healthy person.
Yeah, and it should not be a substitute for vaccination po. It should not be given for prophylactic reason.
Right,
Ito lang
because
po yung diagnose.
some guys might think that this is really a preventive thing if you
It
it's
should not
only for the person who has already the symptoms
be. Correct po.
of but malaman nilang when a healthy person should not
take it.
okay, thank you.
Okay. Sige po.
Salamat.
Opo.
You can go ahead.
Oh, yeah. Then the DOH will be coming out with the guidelines also on how this can be accessed as an oral drug po ito for mild and non-hospitalized COVID-19 patients. So, next slide po tayo. Then we have the Paxlovid po, another antiviral. On January 4 po, the Philippine government and Pfizer already signed the CDA, Confidential Declaration Agreement. And tomorrow po at 1 p.m., I will have a virtual meeting with the Pfizer company to discuss po their plans for application for an EUA registration. And we will discuss po timelines, including FDA requirements po, so that we can adjust po, we can level off po how they can comply with our requirements, considering that it is an EUA application, not a CPR application. For emergency use po talaga ito. We need this po in our country.
People might think about the confidentiality of things. These are one of the few exceptions that we cannot forgo. We have to sign it to get the medicine. Standard do yan everywhere, anywhere. Yung confidentiality, there has to be an obligation on the part of the beneficiary of the medicines to sign that declaration. Yung iba kasi ng bakit hindi, it's a public, no, it's not. It is a public document, but it is confidential. Not all public documents are really open to everybody. Yan ang intindihin ng iba. Baka sabihin niya, baka may ano dyan ha, ang usual is mayroong kickback dyan, gano'n. So, may mga, yung utok bulinaw, bulinaw? Bisaya ka ba?
Kabalo ko sa Bisaya.
Oh,
Taga-Davao man ko, sir.
Ano man Tagalog sa bulinaw? Bunilaw rin?
That small fry fish pa yun, small fish Dilis nga. Pero smaller
Otak
than dilis
dilis.
pa
Makita nilang confidential declaration, they always insist that the public should know. Kaya I'm just giving this advance information that we cannot get all of the medicine unless we comply with that confidential declaration agreement. And it applies to all. It applies to all ito ngayong mga medisina to fight the COVID. It's not only Pfizer, it could be Moderna, meron talaga yan. So it's a universal practice in the medical field. So we understand. You have to talk to them. And again, they would insist on the confidentiality of that. Kasali ka na dyan. And we understand. And I'm sending this message to the public so that, sabi ko nga, yung utok bulina would start again to question and doubt the sincerity of ang problema kasi sa kanila, pag may makita sila transaction, well, of course, they are free to entertain doubts. But these are things na which we cannot do, unless we want to forgo with the supply of medicines in this country. Go ahead.
Yes, next slide please. Sir, if you remember, nagkaroon tayo ng increased price parang black market of remdesivir. So finally, this way will come to an end because we have given already the CPR last December 27. So that means it can now be supplied to public drug outlets. So dapat mawala na yung black market. So this will help, this will prevent overpricing in the black market. Wala na talaga dapat na black market kasi we encourage for the patients and even their loved ones to buy their medicines from FDA licensed drug outlets.
No, you know what? If you can give us a report, sure, even a syllabus of, so the police chief is or his representative maybe is part of the panel there, and they should know how to respond. Yung black market, at this time, lalo na may naghihirap, yung black market, yung nahuli, I would insist for the police to arrest them and detain them for investigation. If it's a serious offense, that will be about 34 hours of detention. And in that time, you can investigate. Hulihin talaga ninyo at ipasok ninyo sa selda. Again, I am ordering the police to arrest black marketeers. Dalhin sa istasyon, pasok muna dyan sa selda without exception. Without exception. Kay ang may-ari, lahat, I am putting on notice the entire PNP at itong mga the station commanders, any transactions of black marketing of this essential medicines should be arrested. Walang exception. Kung may-ari, kasi kung ano lang, ahente, usually magsabihan sila, hindi namin alam na nagpapabili pala yung mga sales representative sa baba. Yun ang paborito nila eh. Sabihin nila, even is a matter of violations, wala kami, yung aming mga staff lang. Do not give me that shit. Hulihin ninyo at ikulong ninyo. And I think that's a serious offense. You can detain them for 34 hours. Pero ilagay mo na sa detention para makatikim rin sila ng, or maybe if there's a fiscal, they can have a summary file the case. So from the police stations to sa prison muna in the meantime, unless of course they go out on bail. Pero pag gano'n, if there are prosecution, I would like to know there's always a inquest. If it's an inquest, wala na yung answer in 10 days of counter affidavit. Inquest is almost summary. And if the fiscal decides to file the case immediately, then the arrest is the arrest is coupled with detention. Yan ang dapat sa kanila. Sabi ko, no exception. Hulihin ninyo ang may-ari. Kung ang sales girl lang, then arrest the owner. No exception. Arrest them and detain them for 24 hours. And I think that is a serious offense, black marketing. This time, if you do that, talagang upakan ko kayo. I would request the Department of Justice just to assign fiscal so that they can conduct the summary investigation. Summary ang inquest na. There's an inquest immediately. Again, no exception. Solve the, I'm asking the police now to not only apprehend, solve the problem in your area. If you cannot operate successfully because tamad ka or you do not go out o yung mga tao mo to find this where these crimes are being committed, then sabihin mo sa akin, kasi sabihin ko sa PNP chief, just to dito sa secretary anyo, here the supervision over the police. Hindi, maghanap ako ng ibang police na magtrabaho. Tapos i-assign kayo sa, ano bang pinaka-troubled place ngayon, sir? Wala na, ang sulo, okay na. Itong mga komunista naman, they're already considerable reduced in number. We have, the military and the police have destroyed so many fronts. But still, I have a good word for you. Thank you for not being an obstructionist in the operation, in the matter of the aid given to the people. Kasi yung iba, pag alam nila na binigyan ng 5,000, baka maghingi kayo. Kasi yung ayuda ng gobyerno, balita ko lang, pinupuntahan ninyo, yung ibang report, sabi kinukuha ninyo yung pera, pagkagago naman ninyo. That's stupid. Tulong yan sa kapwa-tao. Maghingi lang kayo, basi 500, okay na yan. Huwag ninyo kunin lahat ng pera ng tao. PNPA kasi. You know, you have to. Kayo, I'm directing myself to the Communist Party of the Philippines. At this time of our national life, we are having a serious problem. If you cannot cooperate, if you cannot help, then you maybe just stand aside and let the government, allow government to operate. Kaya yung mga nurses na sa NPA, nag-NPA, marami kayo. Yung mga, mayroong mga nurses, talagang Then, magbaba kayo, I assure you, if you give us an advance and notice that you are going down to participate in this people who are offering their services. Total, magbayad man ako, magtulong kayo. Tapos, pagkatapos niyan, I will also guarantee that you can go back to your unit and fight another day. Pero kung pababain ko kayo because magutulong kayo, okay masyado. Pagkatapos yan, magkape pa tayo dito sa aking opisina so that you'd makita ninyo yung palasyo ng tao. Malacanang Palace is not a palace, it's puro opisina yan. Ewan ko kung tinawag ng palace na, yung mga gago noon, mga Kastila, pati yung Amerikano. What di? Makita mo dito, takot nga akong itong mga sa ceiling, baka bubagsak na. Mukhang tagal na tayo. So bago ito masira, bamba kayo at I will be gracious. So, as long as you do it for your fellow men, I will be very happy. I will be gracious at magkain pa tayo dito. Remember that yung mga talagang ano ninyo, mga liderato, those that are really died in the wall communist, when I ordered the release, Tiamson spouses, yun ang pinaka, I invited them dito for the first time, ang liderato ng komunista, sabi ko, come and break bread with me, kain tayo dito, dinner. Then we talk. Maganda na. The problem is, I was dealing now with Jose Maria Sison. Bakit may Maria yan siya? Lalaki man. May gano'n ba? Rodrigo Maria Duterte.
Joseph and Mary.
Joke lang yun, ha? Pero ako, I'm really very serious. Ganon ako. Pag magbaba ka with a good motivation and you do it, I will order you can go around and you will not be arrested. And if you are arrested, I will order your release. Pagbalik ninyo, same guarantee. Balik kayo sa bukid. Tapos fight na naman tayo. Kaya yung tamaan marami ng babae na tawag nila dyan sa mga medical. Yung mga nurses nila, tawag nila medical. Kaya yun si Parago, yung number 1 na sa rebel sa Mindanao. Respetado yon. Ang mga military, you have to give respect also for his ability to evade arrest for so many years and had about so many encounters, as a matter of fact, responsible for the killing in battle, yung mga officers. So, wala man tayong dyan. Alam ko na puro pagbalik ninyo sa bukid, ang order ko talaga is kung may encounter, patayin na lang. Away ito eh. You are an army, sabi mo, army of the people. May sarili man akong army, fight tayo. Kaya yung makita ko, although yung matay si Oris, the comid talaga sa Mindanao, kasi kilala ko, nananghinayang ako. Hindi ako naawa. Kasi ginusto ninyo eh. Nananghinayang ako because yun ang isa sa mga dapat. But he has said he died in the world communist talaga. Yung mga ninyo. So, you still have to...
The last slide, we have 121 licensed manufacturers. 5 of these actually were government hospitals, which we licensed last year. And next slide, this will be the last. The next slide. Parehas pa rin po ang ating vaccines. Di po nadagdagan. This will be the last slide, Mr. President. Thank you po.
Sir, magtanong ako, bakit nawala yung Sinopharm?
Nandyan po. Dito po siya, Covovax, then Sinopharm.
Hindi ko makita.
Hayat Vax.
It's my eyes. Even in...
Yeah. Yung Sputnik naman, meron tayong light.
Kasi Sinopharm ang binigay sa akin eh.
Opo.
But including the booster.
Opo.
So, tapos ka na.
Tapos na po. Marami po.
You've said all, let me see, yung, laman si Mon Lopez, Secretary Mon Lopez, we will also be interested to know about the pricing of medicines.
Good evening, Mr. President, mga kasama. Meron lang tayong konting charts, Mr. President, just to update you. Yung mga nabalitaan ninyo recently, especially itong pagpasok ng bagong taon, nagkaroon ng mga mahabang pila sa mga malalaking drugstores at nabalitaan yung supposedly tinawag nilang shortage. Ang nangyari po, Mr. President, dahil siguro dumadami nga yung cases, nag-umpisang umakyat ng December 28, biglang dumami ang mga nangailangan ng ating mga kababayan, nangailangan ng mga paracetamol para panggamot sa mga lagnat or sinat. Yung sudden increase in demand in the start of the new year, talagang naging beyond the normal levels ng inventaryo ng mga drugstores. Kaya nagkaroon talaga ng stockouts. Kaya akala ng mga tao, naku, nagkaubusan na. Pero actually, ang tawag nga lang doon ay stockout dahil naubos yung inventaryo dun sa mabilisang increase in demand. Pero pinaalala po natin na may mga iba pang brands. Ang unang naubos yung mga top brands. Siguro banggitin na natin yung mga biogesic, yung mga ganong klase in demand. No? So unang naubos yun at yung mga iba pang brand. Pero sinasabi natin may iba pang brand, meron ding mga generics at ito ay available. But eventually, dahil nung wala na silang mapili nung top brand, even itong mga generics, nagkakaubusan din dun sa store lang ng mga pinuntahan. Pero hindi ibig sabihin ay may shortage po tayo. Kasi pag sinabing may shortage, buong bansa, kulang ang gamot. So hindi po ganun ang situation. Nag-stock out lang, out of stock, dun sa mga tindahan na yon. Ibig sabihin po nito, kailangan mag-reorder kaagad yung mga branches, yung mga drugstores na yon, mag-reorder kaagad sa mga manufacturers. At ang nangyari nga po, what we did, nag-coordinate agad tayo dito sa mga manufacturers to make sure na yung mga replenishment ng stock sa mga drugstores mapabilis. At lakihan na nila yung order given the number or the size of the increase in demand. At ang balita sa atin, ang report sa atin, they ordered 3 times more the usual ordering level po nila. Dahil nga in anticipation of larger demand, especially ito nga part of their preparation din sa mga pagtaas ng kaso from the Omicron. I have assured the public mula nitong mga 2 days ago nung nasabi itong problema na to, na may malaki tayong production capacity ng mga local drug manufacturers. Very sufficient po. So ang ginapunan natin, mag-deliver agad. So in fact, ang feedback kaagad sa atin, tinutukan natin ito, yung mga malalaking drugstore like Watson's, Southstar, nag-umpisa nang mag-deliver sa mga branches nila kahapon. So nagre-replenish na. Yung isang malaking manufacturer, Unilab, nag-deliver na rin sa Mercury Drug, as you know, isa sa malaking drugstore. At yun po yung nagsimula rin today. So yung nagsimulang problema ng Lunes, na-action na ho as of Wednesday, kahapon, nag-umpisa na. At tuloy-tuloy na ho ito hanggang makahapon, mag-normalize yung stock level natin hanggang maybe in-expect ko natin now until the weekend, mag-fill up, mano-normalize na yung supply ng mga paracetamols. Immediately, in-alert ho natin yung mga manufacturers to replenish at in-assure natin public, may supply, wag ho silang mag-panic buying na yung iba ho magpa-panic buying, bibili kahon-kahon. Ang bilhin lang nila, yung kailanganin lang nila para kasi hindi rin abutan ng expiration pag masyadong marami silang bibilhin. So, yun po ang sinigurado natin, may medisina sa mga retail stores, drugstores, at whether branded or generic. Next slide, please. Nag-issue tayo ng advisory tulad ng in-explain ko kanina, no, na may stock, wag silang may supply It's a matter of replenishing lang yung stock sa tindahan at the tindahan level. Next slide, please. From the Pharmaceutical Healthcare Association of the Philippines, ito yung mga manufacturers din mismo ng mga gamot. Sinigurado nila yung paracetamol available in various dosage forms at lakas, strength, combination products, and under several hundred brands. Alternative analgesics are also available. And at the moment, we have enough supply of analgesics available sa inventaryo nila. Next slide. Pati rin yung Drugstore Association, kinausap natin, at sinabi lang po nila na yung out-of-stock situation actually naging mas prevalent sa NCR. And it is because of that unforeseen surge in demand. But kinausap natin ng mga manufacturers, actually more than 60 million tablets a month ang kayang i-produce ng ating local manufacturing companies. No? So this is not a supply issue. Again, inapura ang mga replenishment that started yesterday. And we expect the supply to normalize at mawala na yung pila. Next slide. Ito ho yung specific kasi para hindi naman baka sabihin, kwento-kwento lang ito. Talagang kinuha natin pati capacity ng production ng bawat brand. Hindi lang natin nilabas dito yung brand, tinago sa mga letrang B, T, R, I, pero mga brand yan ng paracetamol. 36 million tablets per month ang kayang i-produce. Yung isang brand, 9 million tablets per month. Yung isang brand, 12 million tablets per month, etc. So marami yung kayang i-produce at ang bottom line, wala tayong issue sa production capacity. So ngayon nangyayari, delivery lang po ng replenishment at magno-normalize na. Next slide. Tinutukan nun natin, inantayan kung talagang nag-deliver sila kahapon, ngayon, today until the weekend, and so on and so forth. So ito ho, mga specific delivery. So ito, today lang po ito, pinakuna namin just to make sure talaga bang nagre-replenish na kayo. So inapura ho ito sa mga malalaking drugstore. And from the depot ng drugstore, sila magkakalat naman sa lahat ng mga branches. Next slide. So ano na lang po ito, mga report, ongoing delivery like today. Ito ho, nangyari rin today sa Southstar, sa Watsons. And yan po, may mga stock na sa tindahan level, sa store level. So next. And replenishment of stocks ongoing at magtutuloy-tuloy na po ito. So yun lang po, Mr. President, update lang ito dahil para mawala yung pangamba ng ating mga kababayan na akala nila ay may shortage ng gamot. Wala po. Wala pong shortage. At we also, finally, we also appreciate yung ni-report ng FDA kanina, especially yung isang local manufacturer na kinukumbinsi ho namin locally produce nung iba pang gamot tulad nung ni-report kanina ng molnupiravir. We are hoping na mapadali, mabigyan ng green lane para pag local production to, mapapamura. Kasi ang lalabas siya parang generics. So that itong mga gamot na antivirus, those that will kill the virus, will be accessible sa ating kababayan at a lower price compared sa mga imported. Yun lang po, Mr. President. Salamat.
Thank you. So, Art Secretary Tugade, if you are available, you have the floor. Or it's somebody from his office.
Magandang gabi po, mahal na Pangulo. Ako po si Giovanni Lopez po, ang Chief of Staff po ni Secretary Tugade. Secretary Tugade is currently under isolation po at saka yung kanyang that's why po with your permission may I present po the DOTR situation.
Sige, go ahead.
Thank you, sir. So sa ngalan po ni Secretary Tugade, mahal na Pangulo, paintulutan niyo po akong magbigay ulat sa estado at sitwasyon ng DOTR po sa nangyayaring pagtaas po ng COVID cases po ngayon. Bago pa man po pumasok yung bagong araw po ng trabaho sa taon na to, nagbigay na po ng kautusan ng ating mahal na kalihim na gawing mag-mass testing tayo sa ating mga kawani dahil po sa mahabang bakasyon. Kaya po ang naging resulta ay nakakabahala. Tulad po sa aviation sector natin, no, out of 222 po na tested, 68 na po yung confirmed na positive po sa COVID-19 cases. Ganon din po sa ating maritime sector. out of 133 po na tested po, no? Ay, out of 23,000 na ating mga kawani, 133 na po ang ating COVID-19 cases positive. At yung 183 po, yung 50 po nito ay ito pa nadagdag nung nakaraang taon pa po. Next slide please. Ganun din po sa ating road sector. Napakataas na rin po ang ating positive cases. Ito po ay mga ang mga testing na po na ito ay nangyari lang po from January 3 hanggang sa January 6 at kasalukuyan pa rin po ang mass testing sa ating mga kawani sa DOTR at sa ating mga attached agencies. Pagdating naman po sa ating aviation, Mr. President, sinigurudo po at tiniyak po ni Secretary Tugade na yung mga importanteng office ng ating aviation sector tulad ng air traffic management system natin ay kailangan may tao parati at may magmamando doon para hindi po ma-delay ang ating flights. Kaya po niya ng ating mga wani dito ay sana nasa isang bubble lang at iwag na pong lumabas upang sa ganun mabawasan natin ang kanilang possibility na makontaminate po ng COVID-19 cases po. Next slide please. Ganon din po sa ating maritime at road sector, Mr. President. Ginagawa po natin ang regular conduct ng RT-PCR, antigen testing. Ang ating po mga kawani ay nagsusuot din ng mga PPEs, yung mga disinfection natin. Meron na rin po tayong rationalized work arrangement. So lahat po nito ay ginagawa po ng ating DOTR sa pangunguna po ni Secretary Tugade upang pong masigurado na ang ating mga kawani po sa DOTR at ang kanyang attached agencies ay safe at ganoon rin po ay para tuloy-tuloy po ang ating serbisyo publiko, Mr. President. So yun lang po ang aking report, Mr. President, sa ngalan po ni Secretary Tugade. Salamat po.
Thank you. Si Secretary Tugade is not sick. Nag-isolate lang. Ang problema kasi yung pamilya. Hawaan nga lahat itong buang na si Omicron. Let me see Chairman Abalos.
Yes, sir. Magandang hapon po, Mr. President.
Epicenter is your territory.
Yes, sir. Senator Bongo, ES Villaldia, sa lahat po ng mga cabinet secretary, fellow government workers, mga kababayan, magandang gabi po. Slide, please. Okay. Sir, kung nagloloko po yata yung slide, no? Okay. Siguro, sir, ipapakita ko kasi talaga yung taas ng kaso sa NCR. Pero ang gusto kong igiit dito ay yung ilang percent na nao-ospital ang walang bakuna. No? They are about 85% yung mga walang bakuna po. At yung pong namang mga fatality o yung mga namamatay po, ang recorded is about 93%. No? So nakita po at na-explica po ng mga experts, nakita po natin ang record. Kung di ako nagkakamali noong December 27, 500 lang po ang kaso. 500. Ngayon po, 17,000 na, sir. So yung tanong niyo po kanina, bakit ganun? Ako, personally, tingin ko po, siguro po nung holiday, reunion, wala po tayong mga maskara. Siyempre, kakain po tayo. So, malamang, kinukumpute yung incubation hindi ho naglalayo, sir. Tapos pumasok pa itong Omicron. It's one of the possibilities lang po. But in any case, nakakatakot po sa mga walang bakuna. Kaya po ang mga alkalde ng Kalakang, Maynila, dahil po rito, ay nagkaisa. At lahat po bumoto. Nagkaisa po. Babasahin ko lang po. Urging the Metro Manila local governments to enact their respective ordinances on the enhanced vaccination restrictions to regulate the mobility of the unvaccinated individuals in the National Capital Region. So ang mangyayari po, yung po mga walang bakuna, sir, ay it's as if sa bahay lang sila. Yun po ang gagawin na pagkasunduan po ng lahat ng alkalde. Just allow me to read. 4 lang po naman to, mahal na Pangulo. Number 1, the unvaccinated individuals in the NCR shall, number 1, remain in their residences at all times, except for the procurement of essential goods and services, such as but not limited to food, water, medicine, medical devices, public utilities, and energy work, medical and dental necessities lang po. Provided, however, that individual outdoor exercise shall be allowed within the general area of the residence that is within the barangay, purok, subdivision, or village subject to the guidelines of the Metro Manila. So yung pong walang bakuna, bawal po talaga lumabas ng bahay, pwede lang kung bibili na essential o kailangan magpagamot. No? Pero po, pwede naman sila mag-ehersisyo. Number 2, be prohibited in indoor and outdoor alfresco dining in restaurants and other food establishments, and shall likewise be prohibited from leisure or social trips to malls, hotels, event venues, sports, country clubs, and similar facilities in accordance with the guidelines of the Metro Manila local government units and the concerned establishments. Number 3, be prohibited in domestic travel via public transportation by land, by sea, by air, except for the procurement of essential goods and services, such as but not limited to food, water, medicine, medical devices, public utilities, and energy work, and medical and dental necessities subject to the production of proof to support and justify such travel. Pinakahuli po, and this is just a reiteration po ng IATF rule, sa mga manggagawa naman na walang bakuna, they should be required to undergo an RT-PCR every 2 weeks at their own personal expense and present a COVID-19 negative result prior to being admitted for work on site, consistent with the guideline, rules, and regulations issued by the IATF and the Department of Labor. Provided, however, that in the event the RT-PCR test and or result is or are not immediately available, a rapid antigen test may be utilized in lieu thereof. Ang dinagdag lang po ng mga alkalde rito, dahil ito nga'y krisis, dumodoble, ang sinabi nila, this resolution shall be enforced and in effect while the COVID-19 alert level in the NCR is at alert level 3 or higher, and shall be automatically lifted once alert level 2 or lower is declared. Kung hindi po ako nagkakamali, may mga LGUs na naipasa po ito. Kanina po, may mga ibang LGUs na nag-hearing na, kinukuha yung materials, na pagkasundoan po ng lahat ng alkalde ng Kalahang Maynila na uniform ang gagawin po nila ordinansa rito. Ito po'y bilang proteksyon na rin sa mga walang mga bakuna, Mr. President. Ganun po. At of course, ang pinakahuli ho siguro masasabi ko, wala lang yung, eto pala yung kanina. Tignan nyo, Mr. President, negative 51 noong December 18, nag-285 hanggang December 31, in 1 day, nag-501. In 2 days, ng 1,095% ang growth rate, biglang pumatak ng 3,400 ng January 6. Next, please. Next slide. Next slide, please. Okay. Tignan niyo ang ADAR. Noong December 5.63, pumalo po ng 0.55. Siguro ho talaga yung kapaskuhan nung nag-holiday na wala mga mask, 3.76, bigla pong halos times 6 ng 18.53 ang average daily attack rate. Next, please. Next. Ito po ang active case. Oops, pakibalik lang. Pakibalik lang, please. Okay. Tignan nyo, sir, ito po yung sinasabi ko in December 27 na 570 cases lang. So siguro kung nakita nung December 24, no, yung dispiras ng Pasko, no, ayan po, biglang humataw ng 15,000 Nag-17 pa nga. Ito yung mga kaso na binibigay sa amin ng mga city health workers. So dito po natin makikita talagang siguro part nito ay humaliw yung Omicron doon sa Kapaskuhan na nagtipon-tipon ng mga pamilya. Next please. Next. Ito po pinaka-importante sa lahat. At sana ito po maunawaan. Pakibalik lang, please. Pakibalik. Na 85 of those severe and critical are unvaccinated. Ito pinaka-critical sa lahat. Talagang sa Metro Manila po, marami nakakasakit maski may bakuna dahil 105% na po kami eh. Ngunit, yung severe at critical, 85% walang bakuna, Mr. President. At 93% ng namamatay ay unvaccinated. This is a DOH record, sir. Next, please. Kung kaya, ito ho, maski nung holidays, lahat po ng mayor, sila Secretary Vince, Sec Anyo, sila Sec Galvez, sila Sec Charlie, mga sekretary po, nagtatrabaho po kami. Minomonitor na po namin ito. Noong 28, noong January 2, no, maski pagkatapos po ng bagong taon. Next, please. Next. So, yun po yung binasa ko resolusyon, kaya ginawa po namin to. Sana maunawaan. Kanina may nag-i-interview, magdidemanda raw sila because of human rights. Pero sana maunawaan nila, we are restricting the mobility ng walang bakuna precisely for their protection. No? At nasabi po nga po kanina ni Secretary ni Dr. Edsel na yung mga variants, mas madami doon sa mga walang bakuna, sir. Next, please. Next. So, bukod po rin, sir, kinuha namin, pinaghandaan pa namin noon pa ang kinakailangan namin, ang mga test kits. Ito, nagpapasalamat po kami kay Secretary Vince Dizon dahil sapat po ang aming testing kits po sa ngayon, mga RT-PCR. Next, please. Ang Department of Labor, maraming salamat, Secretary Bello, napakabait mo. Expired na po ang aming contact tracers, pero nirenew pa kagad ni Secretary Bello. Of course, si Secretary Anyo, no, kasama na po ang sa DILG at sa DOH. Nagsabi po sila, titignan po nila ito at agad po nilang gagawan. Kasi yung po importante, yung po mga contact tracers. Yung facilities, tignan nyo po ito, Mr. President. Nung kasagsagan ng Delta, 90 facilities namin, 65% puno. Pero ang Omicron, 95, ngayon pa lang, nagsisimula pa lang Omicron, pero halos kalahati na ho ay halos puno na. Kung kaya dahil dito, next please. Next. Ito po yung mga LGU isolation na talagang binuhay ulit ng mga mayors, no? Yan po sa iba-ibang lugar. Next. Next. Next, please. Okay. So, ito, ayan. So, dahil mapupuno na po ito po yung dati na namin ginagawa. Ito po yung approved. Pakibalik lang, pare. Pakibalik lang, please. Ay, nawala. Ayun po nasa kaliwa, yung tinatawag naming, pakibalik lang, please. Pakibalik. Okay. Ito po yung home care na tinatawag, yung nasa TV po, no? Home care guide. Na kung saan, pakibalik lang please, pakibalik. Importante lang para makita ng Presidente. Okay. Ito po yung ginawa ng DOH, ng res bakuna ng PhilHealth, na po pwede i-home care ang iba, meron lang parameters. Titignan yung bahay, kung po pwede, pupunta sa barangay at yung mismong health ng barangay, yung BIRDS, barangay emergency room, iti-check. At talagang yung iba ho, pwede na mag-home care. No? So ito po, mapupuno, ito po yung ginagawa, ang home quarantine and isolation. Next, please. Next. So ito po ngayon ang importante. Lahat po ng sa mga mayors po ng Metro Manila ay meron po mga telephone number. Tatawagan po iyan at pwede mag-advise ng telemedicine at pwede hong puntahan kaagad. No? 24 hours po yan, yung hotline center ng mga LGUs ng Metro Manila. Next, please. So, ito na lang ang final po namin. Sa ngayon po, ang nabakunahan po natin ay 106% na po. 10.4 million. No? Sa booster shots naman, ang tinatarget po namin ay 763 for January Ngayon po ay nakaka-727 na po tayo. Maganda na po, right on target. Sa pediatric, ito po yung mga bata, no? Ang target po rito is 1.4 million, nakaka-919 na po tayo ng first dose at 804 po ng 313. Double time pa rin po kami dito dahil talaga ang tanging solusyon dito is sa pinakasolusyon ay ang pagbabakuna po. Yun lang po, Mr. President. Thank you po.
Maganda yung, well, the steps that you have taken to meet the challenges of our serious problem now. Kung wala na
Mr. President, Mr. President,
Secretary Bello.
the estimate of my partner, Secretary Mon Lopez of DTI, ang under alert level 3, Mr. President, we're expecting that there will be 100 to 200,000 workers that will be affected. And when we say affected, Mr. President, ibig sabihin, either mawalan sila ng trabaho temporarily o kaya mababawasan sila ng number of working hours.
But magsingit lang ako sa iyo. Maitanong ko lang, itong 200, para anong lugar to? Metro Manila?
Ito sa NCR, Mr. President. Dito sa alert level 3 sa NCR, Mr. President.
Go ahead.
Now, Mr. President, in anticipation to the possibility of some of our workers being temporarily terminated or will be having reduced working hours, our department is prepared to provide, in the case of the tourism industry, Mr. President, yung CAMP, this is the COVID-19 Adjustment Measure Program. And upon the funding of Secretary Berna, Mr. President, we allocated 50 million for her workers in the tourism industry. However, Mr. President, in case of war scenario, we may be compelled to allocate 1 billion for workers who will be affected by this level 3. But having said that, Mr. President, we are very happy to report that so far, as of today, only 3,284 workers were displaced nationwide, Mr. President. And this involves 267 business establishments. With respect to the workers affected by the we call the working arrangement, only 5,762 workers are affected under this flexible working arrangement. Ibig sabihin, nababawasan yung number of hours nila, Mr. President. Limbawa, instead of 5 hours o 8 hours a day, gagawin na lang 5 hours a day. Meron din, instead of reporting for 5 days a week, ginagawang 3 days a week, nagro-rotate na lang. Ito yung flexible working arrangement, Mr. President. And unfortunately, meron naman din what we call temporarily closed business establishment. Pero konti lang ito, Mr. President. Dahil siguro sa leadership ni Secretary Mon Lopez, only 333 business establishment went into temporary closure, Mr. President. So ito po, Mr. President, ang aming pinag-aandaan na kung sakasakali, handa naman ang Department of Labor na mag-provide ng one-time cash assistance sa mga ma-displaced workers. Yun lamang po ang aming report, Mr. President.
Salamat, Bot. But, worst case scenario. Sapat na kaya yung 1 billion mo?
Mr. President?
Worst case scenario.
Worst case yung
ang
Hindi naman
unemployment
siguro abot,
aba yan.
Mr. Opo, Mr. President.
Uh, kaya nga, kailangan sapat na ba yan? So, tulong in the long run. In the long...
Kung ako lang naman, Mr. President, itong alert level 3 hanggang January 15 lang naman eh. Ngayon, kung tatagal pa, kaya medyo talagang dadami ang madi-displaced workers. Especially so kung pinag-uusapan na po yung alert level 4. Ang pinakamalaking dagok dyan, Mr. President, yung ating accommodation and yung restaurant and construction as well as transportation. Malaking dagok sa kanila, Mr. President.
Talaga, the economic side is getting a heavy whipping dyan sa ano.
Mr. President, okay naman kami. We are prepared for any eventuality kasi maganda-ganda naman ang budgetary allocation na binigyan nyo sa amin. Especially doon sa aming programa para sa mga informal workers. Yung sa programang TUPAD, Mr. President. Thank you for that.
Kasi kaibigan kita.
Thank you, Mr. President.
Hindi, dahil talaga kailangan ng mga tao, no? Kailangan ng Pilipino, workers eh. So, kukunti lang naman yung walang trabaho at this time, Metro Manila. Sige. Okay ka na? Tapos ka na, Bot?
Okay na po, Mr. President.
Well, okay. Salamat, Bot. Secretary Nograles, Carlo, he might have something also to contribute for today's program.
Yes, maayong gabi, Mr. President, Senator Bongo at ES Medaldea sa mga kasamahan natin sa gobyerno. Mr. President, ipepresenta ko lang po yung napagkasunduan at napag-usapan namin sa IETF, sa IETF po ninyo. So, ito po yung mga napag-usapan doon. Itong health, yung sa alert level system po natin, meron po tayong i-elevate to alert level 3 dahil sa pagtaas po ng bilang ng mga kaso ng COVID-19 at ito po yung napagdesisyonan po ng inyong IATF na beginning January 9 up to January 15, 2022, iakyat na po natin to alert level 3 ang Dagupan City, yung City of Santiago, ang Province of Cagayan, Olongapo City, Angeles City, the Province of Bataan, Pampanga, Zambales, then Naga City, Iloilo City, Lapu-Lapu City, Batangas Province, Lucena City at Baguio City. Yung sa Lapu-Lapu City, naka-asterisk po yan, Mr. President, dahil gusto rin po natin i-check yan ng DOH na pataasin yung kanilang allocated na hospital beds doon sa kanilang mga hospital sa Lapu-Lapu City, kaya naka-asterisk po yan. At pinag-uusapan na rin po natin ng inyong IATF ang isa pong indicator apart from healthcare utilization rate, which is yung mga hospital beds at ICU beds at mechanical ventilators, ay maaaring isa pang indicator na titingnan natin ay yung ating mga healthcare workers. Kasi gaya ng sinasabi ng mga eksperto natin kanina, mga health experts, and based on the experience sa ground, marami na po sa mga healthcare workers natin ang under quarantine dahil na-expose po sila ng positive cases ng COVID. At meron din po nagkaka-mild COVID, kaya isolated din po sila. So we have to look at the HCW or healthcare workers natin as isa pang indicator sa pagdedesisyon natin ng alert levels. Next slide. Ito yung sinabi ng FDA kanina, which napag-usapan din po sa IATF, at kami rin po ay nagpapatulong din sa DTI through Secretary Mon Lopez na to actively call on yung mga manufacturers na magparehistro na sa FDA ng mga self-administered antigen test kits or yung mga home test kits. Kinakailangan po talaga na dumaan sila sa FDA at bago sila ma-approve ng FDA para may mga options din po for home test kits. Napag-usapan sa IATF, Mr. President, na kailangan itong mga home test kits na ito na dadaan sa FDA bago ma-approve is it should be simple to use. Dahil sa home test kits po, hindi po healthcare worker, hindi po doktor or nurse ang gagawa niyan, kundi yung mga gagamit nito ay nasa loob ng bahay. No? So it's a home test kit. So they have to have ease of use at madaling yung instructions at madaling gamitin. And of course, it has to be accurate. Ito yung sinasabi ni MMDA Chair kanina that we hope to be able also to do this on a nationwide scale. Yung policy shift din po natin to home quarantine and isolation para sa asymptomatic at mild cases lalo na. Pag yung mga conducive na mga homes for isolation and quarantine. So quarantine po, Mr. President, yan po yung para sa mga exposed sa mga COVID positive. Yung isolation naman po ay para sa mga may COVID pero asymptomatic or mild. And we hope dahil to be able to encourage more people na pag mild at asymptomatic, pag conducive yung homes for home isolation, mag-isolate na lang po sa bahay at gagamit na lang po ng telemedicine. Then of course, yung healthcare workers din natin, pinag-uusapan, gaya ng sinabi natin kanina, is we have to consider also the reduction ng mga quarantine at isolation ng home ng healthcare workers natin dahil pag quarantine sila at naka-isolate sila ng mahaba, ayaw po natin na mangyari na maubusan po tayo ng mga healthcare workers na magmaman ng ating mga hospitals and healthcare facilities. So yung hospital infection prevention and control committees ng mga hospitals, bibigyan po ng DOH ng guidelines. Makikipag-ugnayan ng DOH sa mga hospitals to allow them to shorten pag kinakailangan yung isolation and yung quarantine. Yung isolation pag talagang kinakailangan, pati yung quarantine ng mga healthcare workers natin. We will be coming up together with the strategic communications team ng NTF with simplified versions nito mga updated quarantine and isolation protocols para sa healthcare workers lang po. Because we need to ensure that meron po tayong healthcare workers sa ating mga hospital and healthcare facilities. And then of course, reviewing again the price caps ng mga medicines and different test kits. So can we go directly to the resolutions that we passed sa IATF? To the tech team, this is the last of this slide, and can we go directly to the resolutions? Hindi na po ito sa resolutions na lang po. So I will be reading, Mr. President, the resolutions that were passed by your IATF.
Are you finished?
Ito po, just two resolutions lang po, Mr. President. So this is resolution number 156 na pinasa po ng IATF. Can we go down to the after the dispositive position? So letter A, previous slide. So letter A, yung hospital infection prevention and control committees will be authorized. So dito sa mga hospitals, sa infection prevention and control committees po nila, they will be authorized to implement shortened quarantine protocols of 5 days for fully vaccinated healthcare workers. No? And then in extreme circumstances, in extreme circumstances, yung mga fully vaccinated healthcare workers din po natin na under isolation for in extreme circumstances and weighing the risks and benefits, pwede rin pong ma-shorten ang kanilang isolation protocols. But the Department of Health will be coming up with specific protocols kung paano natin ma-implement yan. Then the next page, letter B, yung home isolation, as mentioned kanina, Mr. President, yung home isolation ng mga COVID-19 confirmed individuals na asymptomatic, mild or moderate disease, and home quarantine for close contacts of suspect, probable, or confirmed COVID-19 cases shall be allowed kung conducive isolation. Again, the Department of Health will be releasing strict protocols para ma-implement po ito. This is the first resolution, and then the next resolution, please, tech team.
Are you through?
Yung resolution na lang po, Mr. President, on the alert levels. So ito po yung pinakabago na alert level for alert level 3 na in-escalate po natin as announced a while ago. Please go down to the dispositive position provision.
Sa baba. Sa baba.
Yeah po. Next page po. So under alert level 3 po, beginning January 9 up to January 15, 2022, ang Baguio City, ang Tagupan City, ang City of Santiago and Cagayan Province, ang Angeles City, ang Province of Bataan, ang Olongapo City, ang Province of Pampanga and the Province of Zambales, ang Province of Batangas and Lucena City, then Naga City, Iloilo City, and Lapu-Lapu City. But again, Mr. President, sa Lapu-Lapu City, kailangan po ng immediate allocation ng additional dedicated beds for COVID-19. Lahat po ng other provinces, HUCs, and ICCs, including NCR, will maintain their current alert level classification, Mr. President. So that's the latest po from your interagency task force. Maraming salamat po, Mr. President.
Thank you, Secretary Nograles. Kung wala na, si Justice Secretary.
Very short, Mr. President. Nung last Tuesday during our cabinet meeting, IATF, you appealed to the religious sector, to the religious authorities na kung po pwede po na nilang ituloy yung mga religious mass gatherings this month, particularly yung Translasyon, celebration of Santo Niño, etc., etc. And although you have conveyed that message on air, you requested also me, in particular, to deliver personally to the hierarchy of the Catholic Church your plea or your request for the cancellation of these activities. So yesterday, Mr. President, I sought an audience with the Archbishop of Manila, and I conveyed your message personally. And Archbishop wanted to also deliver the message to you that he was very pleased and he was very happy that you have kept the lines of communication between the government and the Catholic Church open. He committed to cooperate in these matters pertaining to public health with the government. And he just requested, Mr. President, that it might be necessary for us to beef up the law enforcement units that will be deployed more particularly on January 9, the day of the Feast of the Nazarene, because the Archbishop said that he may not be able to contain or control the huge number of devotees who might insist to come as close as possible to the Quiapo Church. And he also, so true enough, Mr. President, this morning, in accordance with his undertaking, he made a public statement to the Catholic followers, especially the devotees of the Nazarene. And he also further requested us if we could help disseminate his statement to the people who might not be reached by his public statement. So marami raw po kasi yan. We're talking about millions and millions of devotees. Yes. Baka hindi raw po makarating sa lahat ng kinaukulan yung kanyang panawagan. Kaya po humihiling ng tulong sa atin na kung pwedeng tumulong din po tayo na ma-disseminate yung kanyang panawagan sa mga followers ng Black Nazarene. Yun lamang po, Mr. President.
Well, now everybody is also put on notice that the Roman Catholic Church has agreed to our suggestion that they forgo the celebration. Walang procession sa Black Nazarene. God is always there. He's everywhere. You just pray for the country para matulungan ninyo. Kasi kung mag-congregate kayo, dagdagan ninyo ang problema. And it becomes a heavy burden on government. Ayaw naman namin magsita ng tao na sabihin, walis ka dyan kasi ganon-ganon. That is not a pleasant job. So, spare us, mga kasama ko, yung Black Nazarene procession will not take place. God will understand. He knows the problem. So, magdasal na lang tayo. So, kung wala na, I will continue with the memorandum. We are reverting back to a stricter quarantine protocol to minimize mobility and exposure of the coronavirus. Our minimum public health standards shall be strictly enforced, and violations shall be dealt with accordingly under the law, especially under Republic Act number 11332, or the mandatory reporting of notifiable diseases and health events in public health concern. To our countrymen, please follow persons in authority who are enforcing the restrictions and public standards. Must obey. Mandated na ito. Kailangan sumunod. Hindi lang sabihin kung gusto mo. Susunod kasi, I said, otherwise you deal with the police or maybe the military on a long stretch. In local communities and barangays, your barangay official, including barangay tanods, are agents of a person in authority. Mali yung sinulat dito because they cannot be considered person. Only the barangay captain is a person in authority. It attaches to the position. No, yung mga barangay tanod pati barangay officials, ito yung ang police kasi ng barangay is the tanod. So ito, they become agents of a person in authority. Kagaya na rin sila ng mayor. Sa akin, tabla tayo ng title. So if you are appointed by the person in authority, you become an agent of a person in authority. So kayong mga barangay tanod, trabaho talaga ninyo yan. Now, in progressive areas, yung allowance ninyo maganda man. I think you get a bigger share of the city's fund. Yun namang mga mahirap, tagalogin ko muna na tumulong na lang kayo, kusang loob na lang ninyo, nakikiusap ang gobyerno para tumulong. at tatrabahuin niyo yung trabaho ninyo. Sa mga Bisaya, sunod mo sa gobyerno, sunod mo sa inyong barangay captain, kay naa sila specific order, gikan nga rin sa taas, sa ako, padong sa ila, nga naa sila sa poder, o ang tanang mga problema na ginatagaan og solusyon sa gobyerno, inyo pong tumanon in your local barangay. The Metro Manila Council and specific LGUs in NCR have resolved to limit the movement of persons who are unvaccinated. This will be enforced with much concern for public health, above all else. On this note, I appeal once again to our kababayan who are unvaccinated. Yan lagi ang problema. Kung unvaccinated ka, hindi sabihin na that you are being, you're on a force talaga. Pinipilit ng gobyerno na talagang nasa bahay ka lang. That is a forced gesture of government. Either sumunod kayo o magkawatak-watak itong bayan kung magtigas ang ulo ninyo lahat. So, ito ay kung maglabas naman kayo, punta na kayo doon sa, ano ba ninyo katakutan na lahat bang kami dito bakunado? Wala mang namatay. At least wala pa. Baka mauna ako. Pero nagpabakuna ako. Ngayon, kung hindi talaga you get reinfected or your antibodies is not as good as the others, then malas lang. Lalo na mga senior citizens, kung makalakad ka pa, kindly, kung hindi, pagkatapos ng araw, mayroon bago mag-uwi yung mga yung mga nagbibigay ng injections, you just request one of them to go to the place if the person is not in a position to matanda na. Pero kasi kung matanda, hindi naman sabihin ng bata o matanda, lahat naman tinatamaan. Pero huwag kayong magpanik. Huwag kayong maalarma. Kasi nandiyan pa naman yung gobyerno. Ano ba naman ang... At kung yung iba nagbibigay ng medisina, do not, buy susubra-subra. Huwag mong ramihan. Kasi yung paracetamol is being used by almost everybody who are sick, and there are plenty of Filipinos who would need it. Most kindly be considerate and do not buy more than what you need. Wala total yung we're just asking yung mga kumpanya, they're asking for time to make the inventory again. Nagbibigay sila. Sabi ng mga drug companies, walang problema. Yung paracetamol is available. There's enough supply for everybody. We are a strong and resilient nation. And our bayanihan spirit and genuine malasakit, we can prevent another surge from happening. Alam mo, may awa naman ang Diyos. May wala lang kayo. I still believe na may sarili akong Diyos. My concept of my God, not necessarily yung mga reliyon. Sana makinig kayo sa amin. Total, maparaman ito sa lahat. para sa lahat sa inyo. Para sa ating lahat. So, maraming salamat sa inyo pagkikinig. Club.